Could you tell me shortly how you got interested in medical cannabis? What motivates you actually?
I had a big clinic of pediatric epilepsy. And since my clinic is comprehensive, meaning that I'm supposed to give all the optional therapies to my patients, when the patients started to ask for cannabis, actually it came from the patients. I decided that I would go for it and I check it because initially I didn't really know would it help or not. So, and I believe that they deserve all the optional therapies. So I'm in the field of cannabis and epilepsy for about 4 years, even more. And after summarizing my data in the first 2 years, I came to a conclusion that it really does help a certain subgroup of patients. And since then, I'm quite satisfied with the new option that I have. And I'm using it with great joy.
If you could now compare conventional treatment of epilepsy with medical cannabis treatment.
Our statistics shows that the first medication would help in about 50% of the patients. Second medication, whatever it is, will help only in between 10 to 15%. Third medication would help only in 5%. So in this place, cannabis come in because cannabis will give us a good response in close to 25%. So I would say that after the first or the second, the cannabis has already more chances of helping the patient than any other medication.
We know that medicines have all side effects. What have you noticed at your patients?
I've seen a lot of side effects in my patients, even though that I'm treating them mostly with CBD and almost no THC. However, CBD alone also has a lot of side effects. However, these side effects are generally mild and definitely reversible. So actually I'm not afraid.
What do you mean with reversible side effects?
It means that if I stop the CBD, after 1 or 2 days the side effects disappear.
Is medical cannabis treatment complementary or is it also independent?
According to the laws and indication of the Israeli Ministry of Health, it's complementary. But about 1/4 of my patients stopped taking other medications and now either stopped or reduced significantly, and now they are either without any other medication or with much lower dose of other medications.
All the speakers you were talking about the entourage effect. Do you notice at your work a difference between natural extract of the whole plant and, let's say, single isolated cannabinoid?
Well, as opposed to Ljubljana, where Professor Neubauer has had a chance to check a single molecule as opposed to a combination of derivatives, in Israel we can get the material only from the farmers. And the farmers are giving us only strains. That means we have the extract of the whole plant. So my only experience is with the whole plant. However, I think that in the literature we already have enough evidence that there is an entourage effect. If you take a single molecule as opposed to the whole extract, the entourage effect is actually applying that the whole extract is better.
Do you think it makes sense then to produce single isolated cannabinoids for the market?
I think that many companies are moving now towards what we call formulations, using a combination of some derivatives, but maybe we don't need the whole extract.
Do you think it's important for physicians who treats patients with cannabis to have a specific knowledge about endocannabinoid system?
Yes, I'm sure that's a good question. I'm sure we are in a phase that many physicians they don't start treating with cannabis, and many of them are actually saying that there is not enough evidence. However, me and some of my friends are convinced that cannabis is helping at least significant subgroups. In Israel, for example, they started to teach the theories and the facts about cannabis in all medical schools.
If you could describe a little bit how you organized this system around the medical cannabis in Israel. Is it working well? Do you see any pluses, minuses so far?
I think the medical system in regard to cannabis is not fully capacitated, and it's not well organized yet. However, due to the fact that the Ministry of Health is actually helping and is agreeing to sit with different physicians' organizations and to discuss new indications, the usage of cannabis in Israel is growing all the time, and we have to fix so many things along the chain. About the agriculture, about the manufacturing, about the delivery, about the prescribing, and confirming the licensure from the government takes time, so some patients are waiting for 2 months. But if you compare it to many other countries, I think the patients in Israel are lucky.
Is cannabis available for all patients?
Yes, of course. All types of diseases that the Ministry of Health agreed with the physicians that there is an indication. In some medical fields, I think most of the world who is interested already know that it is positive, it has a positive effect, and it's very efficacious. And in some other fields, medical fields, we don't know yet. So when a group of physicians will approach the Ministry of Health, there is a specific committee, and sometimes it's also a group of the families, the caregivers. And then the Ministry of Health in Israel will give it a title of trial, a study. Then the physicians have to accumulate the evidence, and after a certain period of time, they will come and say, listen, we already treated 200 patients, and in X% it does help. And then the Ministry of Health is changing the title from trial to indication. For example, in autism, I think the first country in the world that started using cannabis is Israel. In the beginning it was a trial, and after less than 2 years, the results were so impressive, not so much for the communication, but for the aggression, that currently there are 800 patients with autism being treated in Israel, and the Ministry of Health is approving every request.
What do you think it is the future of medical cannabis?
I think it does have a future. I cannot give you advices in which companies to invest your money, but I think it will make a lot of money. It will help a lot of patients. We have still a big gap to overcome, to know exactly which is the subgroup, which are medical conditions, and in each one, which is the subgroup of patients that would benefit, and which exact type of either strain of formulation of different derivatives, components, will help them. So there is still a long way, but if you ask me where will cannabis be in 10 years from now, it will be with us, and it will have very strong impact on medicine. Physicians, I would say only 10 to 20% are convinced in the advantages, not more than that. So even my students, which are now active physicians all over the country, not all of them are using it. But the group who is using it, with the help of the regulation in the specific country, with the understanding of ministries of health that it is a solution, then each country has to undergo its own process, and it takes time. I was talking to parliament members in Panama, I was talking to very high people in Poland, and it takes time, but country by country is starting to use it.
Thank you very much.
You're welcome.